covid19.lincoln.ne.gov to learn more about how you can protect yourself, your loved ones, and our community. We're going to begin with a situation update. At this time, Lincoln has 8 lab-confirmed cases of COVID-19. That's 5 more than we had when I last briefed you. So Interim Health Director Pat Lopez is here to provide more details on those cases so that you have the latest information. I'll turn it over to her right now.
Good afternoon. We have 2 cases reported early this morning, and they are both travel related. One is an older child who vacationed with family in Washington, D.C. and New York from March 6th through the 14th. The child developed symptoms March 21st, and at this time, all the family members are quarantined and close contacts. The other case is a woman in her 40s who traveled to Nashville March 12th through 15th. She became symptomatic on March 18th. She was self-quarantined and is now self-isolated, and her close contacts are in quarantine. On Saturday, we shared with you that a woman in her 20s was identified as positive for COVID-19. She returned from Mexico on March 17th and self-quarantined. She developed symptoms on March 19th. Her close contacts are self-quarantined and none have symptoms at this time. A woman in her 80s traveled to New Orleans on March 6th and embarked on a 7-day cruise. She returned on March 16th, and both she and a family member in the same household self-quarantined. She developed symptoms on March 18th. She has not had any close contacts with others in the community. On Friday, we shared with you that we had a man in his 30s who had traveled to Colorado March 6th through the 8th and developed symptoms on March 12th. None of his identified contacts have become symptomatic at this time. 7 of our 8 cases are travel-related, with just 1 case of community-acquired infection. Again, the community-acquired or community-spread case refers to those individuals who have COVID-19 but do not have any travel history or known exposure to the virus. Currently, we have 252 negative tests, have had 252 negative tests. We currently have 34 tests pending for results at the Nebraska Public Health Lab. The Lincoln-Lancaster County Health Department is also monitoring 120 individuals. And as many of you know now, Nebraska now has 129 cases of COVID-19 and 2 deaths. Bryan has tested 244 people at its drive-through site over the last 6 days. To access Bryan Health's LifePoint drive-through testing, each person needs to make an appointment and have a doctor's order for the testing. We're really pleased to share the information Community Health, CHI St. Elizabeth has provided us that their drive-through testing site will be operational at North Star High School on Tuesday. They will be following the same process as Bryan Health. Their hours will be 2 to 4. So everyone in the community will know that it's a similar process for both sites should you come in for testing.
As we've said before, and we're saying again today, in the coming days, we expect that the number of local lab-confirmed cases will rise. Testing has increased in Lincoln due to increased capacity from private labs and at the Nebraska Public Health Lab. Results are now coming in daily, and it's greatly increasing the number of reported tests. We anticipate that we will report new positive cases daily. The increase in testing is a major step in helping us measure the extent of the prevalence of COVID-19 in our community. I hope, though, that you will also look at the rising number of positive cases reported in Lincoln and let them serve as a reminder that we cannot let our guard down. The rising number of positive cases may lead some to think that these social distancing measures are not working, but this is not so. A rise and then an eventual fall in cases is just the nature of an epidemic. And we want to keep that rise from being a sharp one. Every day that we flatten the curve is another day for our healthcare system to perform and for a cure to be found. Social distancing, staying home as much as possible and staying at least 6 feet away from others, it can be challenging, but we know it works. At stake is our health and the health of our family and friends. At stake is the safety of our doctors and nurses and others on the front lines. They are courageously putting themselves in harm's way, potentially exposing themselves to COVID-19 on an hourly basis with limited access to proper protective personal equipment, while we are being asked to wash our hands and stay home. Which would you rather be asked to do? There are additional sacrifices, of course, that we are all being asked to make. The global pandemic we currently face and the subsequent social distancing measures have created a public health and economic emergency for Lincoln residents and businesses. The recent closures or partial closures of businesses and the resulting loss of jobs and wages for workers have led to unprecedented financial hardship for many in our community. Nebraska residents filed 15,668 initial unemployment insurance claims during the week of March 15th through the 21st. That's an increase of over 1,800% above the previous week. For those who were previously struggling to make ends meet, the pandemic has compounded their worries. And then there are many who previously felt financially secure, but who are now suddenly facing new economic hardship. That's why today I sent an open letter to Lincoln rental property owners and managers urging them to waive or suspend all evictions based on non-payment of rent due to circumstances caused by COVID-19 until the pandemic subsides and emergency health measures have been lifted. I also urge landlords to work with their tenants to waive late fees, devise reasonable payment plans, and to refer tenants to resources that may be available to them to help them make their rent payments. I had a good Zoom meeting last week with RIOMA members, and I want to recognize how many of our local property owners and managers are already reaching out proactively to tenants and to their lending institutions to try to find solutions to make the best of a very difficult situation. We are calling upon others in their industry to follow their lead. And finally, I ask tenants, please communicate with landlords about any financial difficulties that you are facing as soon as possible. Property managers, owners, and tenants are all facing economic uncertainty. And open communication will ensure better outcomes for everyone involved. Resources for residents and businesses can be found at the City of Lincoln website at covid19.lincoln.ne.gov. The open letter that I've sent today is a follow-up to the executive order that Governor Ricketts issued last Wednesday that is intended to defer eviction trials for non-payment of rent until May 31st, when the cause of non-payment has to do with COVID-19. The federal government is also taking steps to keep people housed during the pandemic through a temporary pause on foreclosures and evictions on certain federally subsidized properties. At this time, 68 eviction cases remain on the docket in Lancaster County Court through April 10th, and we know that some tenants still will remain at risk for eviction. Any eviction action taken during this pandemic exacerbates the economic hardships already being felt in Lincoln, and worse still, the displacement of tenants poses a public health threat to our community at a time when we are encouraging everyone to stay home as much as possible and to practice social distancing. So we must all do what we can to make sure that every Lincolnite remains safe, healthy, and housed during this challenging time. One way you can help in this effort is to make a contribution, however large or small, to Lincoln's COVID-19 Response Fund, which you can do by directly going to the Lincoln Community Foundation's website at lcf.org. You can join fellow community members who have stepped up and provided resources that will assist our nonprofit partners in offering basic assistance, including housing assistance, to those who are disproportionately affected by the pandemic. The federal government is also taking steps to provide economic assistance to individuals and families during the pandemic, as well as to businesses, and I want to thank our federal delegation for getting this across the finish line. The Federal CARES Act, passed last Friday, provides for direct payments from the federal government. The amount varies according to income level. You can find a link to help you calculate the amount your family may receive at the city's website at covid19.lincoln.ne.gov. These payments will come in the form of a direct deposit to your bank account or a check in the mail in the coming weeks and months. The federal relief package also includes additional funding for the SNAP and WIC food assistance programs, as well as enhanced unemployment benefits. The latest bill increases the number of people eligible for unemployment benefits by including, for example, independent contractors and self-employed people who are unable to work as a result of COVID-19. It increases the amount of unemployment payments, extends the duration of unemployment payments, and waives certain requirements, making it easier to get unemployment payments. More details can be found at our website, covid19.lincoln.ne.gov. In addition, the Federal Families First Coronavirus Response Act, passed on March 18th, makes some employees eligible to receive up to 80 hours of paid sick leave and up to additional 10 weeks of paid family and medical leave if they are unable to work for reasons related to COVID-19. Employers required to provide this sick leave will be reimbursed from the federal government through payroll tax credits. For more information on your rights as an employee and your obligations as an employer, you may go to covid19.lincoln.ne.gov and our Resident Resources and Business Resources tabs. Finally, small businesses may get immediate access to cash flow assistance through various low-interest loan programs administered by the U.S. Small Business Administration, or the SBA. Federal legislation also provides tax relief to individuals and businesses by, for example, extending the deadline to file federal income taxes to July 15th. And we note that the state of Nebraska has also extended the state income tax deadline to July 15th. Again, more information can be found on our website at covid19.lincoln.ne.gov. Elected leaders at the federal, state, and local level are continuing to look at how we can provide relief to our residents as this health crisis moves forward. In closing today, we have some updates on the directed health measures ordered last Wednesday. We directed people with questions to the health department, and we had 90 calls the first day from people wanting to know how they could comply. Calls were down to just 15 on Friday and 27 today. We also asked those who want to report possible violations to do so using our Uplink app or going to our website and using the Uplink link portal. And we are pleased to see that those are tapering off too. We had a total of 52 reports last Wednesday and Thursday through Uplink, but since then the reports are down to an average of 15 a day. The health department is responding to those reports. We know these measures are difficult for many. What these new Uplink statistics tell us is that residents and businesses understand how important they are and that they are trying their best to comply. Again, those who still have questions about the directed health measures should call the health department, and the number for these kinds of questions about the directed health measure is 402-441-6280. And those who want to report a suspected violation can still continue to do that through Uplink. We also want to take a little time today to share some positive news about successful efforts going on in Lincoln. Since March 18th, our Aging Partners folks have delivered 452 meals to senior residents in our community. That's about 48 clients a day. Tabitha reports that they have delivered about 6,000 meals since March 17th. And since March 16th, Lincoln Public Schools has provided 38,289 meals to students. As you can see, people in our community are stepping up in big ways and small to take care of each other. It's important that despite the social distancing that we're all taking so seriously, that we find ways to stay connected. We need to continue to check in with friends and relatives who may be at risk, if that's a phone call, a text, an email, or other messages of care and concern from at least 6 feet away. It's also been heartwarming to see all the creative ways our residents are maintaining community connectedness. Mike Semred and friends have performed concerts outside senior living facilities. The Cornhusker Marriott lit up the side of its building in lights the shape of a heart. Randy Bretz is inviting his neighbors out to visit at the end of the day from the edges of their driveways, not too close, but just enough to say hello and wish each other well. Another example is the Great Lincoln Egg Hunt that's now taking over our community. That Facebook event started March 20th, and in just 10 days, it has more than 10,000 members who are taking traditional egg hunts to their windows all across town. These small acts of kindness and companionship from a distance mean so much. Keep them up, Lincoln. At this time, we'd be happy to open up for any questions and answers you may have.
Riley Johnson from the Journal-Star.
Hi, Riley. Can you speak up a little bit? We want to make sure we hear your question.
Is this better, Mayor?
Yes, thank you.
Hi. There's been some out the big box stores and so crowds that are not following social distancing are overwhelming the ability to do that. Has that been a concern here in Lincoln, that folks are going to places that are allowed to be open, but maybe in too high of numbers?
Thanks for the question, Riley. I mean, unfortunately, most of our evidence to date is just anecdotal at best. I mean, when I look out my window, I see very few cars on the street, and I saw many businesses voluntarily take the kinds of measures that we imposed last week, weeks before we imposed them. I think people in Lincoln understand how serious this is. I think that may be what we're seeing in terms of the rise in our cases still being largely travel related. But we're looking for ways to try to track this in a more quantifiable way. We're looking at our uplink data, and that is, of course, the complaints that we do receive. We're mapping those on a dashboard and then marking when they're resolved. There haven't been that many complaints in recent days, and we're taking that as a good sign. But if we do hear of more of that, like what's being spoken about in Omaha, we certainly will make sure that our public health officials follow up, because we definitely need everyone to take this seriously. It can be tempting to think, oh, I'm being pretty good, I'm just going to make this one extra trip for something that's not that important, instead of consolidating your trips and being really, really conscientious. I mean, that's just human nature. But every time you cheat a little on a social distancing measure, you potentially increase the risk of becoming a transmitter or transmitting the disease to others in our community. We want that web of protection to be strong, and it takes all of us doing our part and minimizing our movements throughout the community as much as possible.
Other questions?
Riley at the Journal-Star again.
Yeah, thank you, Riley.
I have a question for Director Lopez.
Okay.
Good afternoon, Riley.
Good afternoon. My question is, with the confirmed cases here in Lincoln, to what degree have they quarantined themselves after returning from travel, and what potential for community exposure outside of in their travels has there been that your staff have identified? I mean, do you have updates on some of the 8 cases have been to these locations, or are you going to report that?
Actually, the cases that we've had have all self-quarantined themselves. And so they didn't go out into the community, especially the most recent ones that we spoke of that traveled. They immediately, when they arrived back into the community before they were even symptomatic, they had already quarantined themselves. So they really haven't had community contacts to expose. But if we had, if we had community contacts, we would be sharing that with you.
And a follow-up to that question from Riley again. Hey, sorry. How many of the cases in Lincoln are patients who are hospitalized, and what's the general condition of the 8?
One of the patients in Lincoln is hospitalized, and the last that I knew on that person, and I'm sorry I don't have an update from this afternoon, they were making some progress. None of the other cases in Lincoln have been hospitalized. They've been able to maintain their healthcare needs at home.
Are there any other questions? We really do appreciate you tuning in and helping us get these messages out about how important our social distancing measures are, how important it is to continue to wash hands frequently throughout the day. These are small acts of heroism that will protect our first responders, our folks in our hospitals and ERs who really are counting on us to do the right thing to help save lives, both their patients and theirs. We'll be back again tomorrow at 3:30 with more updates and information about how to keep our community and our residents safe and healthy during this challenging time. Thank you.